Welcome. My name is Nathan Fa. I'm a licensed clinical addiction counselor. So, what wanted to do today with this video was I wanted to discuss relapse prevention with you, really get into its critical role in addiction recovery. Recovery is not, simply about stopping substance use. It's more about learning new ways to think, cope, and live. Relapse prevention can help identify risks, develop coping strategies, and ultimately build a lifestyle that supports long-term recovery. Throughout this presentation, I will be examining the factors that contribute to relapse, evidence-based interventions, and practical tools that anybody can use to help maintain their recovery. Alright, before discussing prevention strategies, I believe that it is important to understand the differences between a lapse, relapse, and recurrence. Many people view any substance use as a complete failure, but these terms help us understand that recovery is often a process rather than a single event. I believe that understanding these distinctions allows us to respond appropriately when setbacks occur and view recovery through a more realistic and compassionate lens. Alright, a lapse is typically a brief or isolated return to substance use, and while concerning, does not necessarily mean that you've abandoned recovery. We see it much more as just kind of a singular event, whereas a relapse is broader and often involves a return to old thinking patterns, behaviors, and eventually substance use. Recurrence is a term more commonly used in mental health treatment and refers to the return of symptoms after a period of improvement. One of the most important concepts to understand here is that a lapse does not have to become a relapse. The sooner a lapse is recognized and addressed, the greater the chance of preventing a full return to active addiction. Relapse rarely occurs because of a single factor. Instead, it usually results from the interaction of multiple psychological, behavioral, social, biological, and environmental influences. For example, someone experiencing depression may also have limited social support, high stress, and poor coping skills. Individually, each factor may be manageable, but together they significantly increase relapse risk. So we must assess all dimensions of our lives, including relationships, physical health, spirituality, thinking patterns, and environmental influences. The more comprehensive our understanding, the better we can prepare for and manage high-risk situations. Alright, next we are going to talk about clinical interventions. These are going to be things that you'll encounter if your journey takes you into a actual treatment setting. So relapse prevention interventions are specifically designed to help people maintain recovery and navigate the challenges that they will encounter after treatment. These interventions focus on identifying triggers, understanding relapse patterns, improving coping skills, and developing recovery-oriented lifestyles. They can be delivered in both individual and group settings and should be tailored, to the unique needs and experiences of each individual person. The overall goal is not simply abstinence, but helping people build sustainable recovery and improve overall quality of life. Effective relapse prevention involves much more than avoiding substance. Individuals need practical tools for recognizing warning signs, managing stress, and responding effectively when challenges arise. One important component is to develop healthier sources of pleasure and fulfillment. Many individuals enter recovery having lost hobbies, relationships, and meaningful activities. Recovery requires replacing those losses with healthy alternatives. Another key element is preparing for setbacks. Rather than assuming recovery will be perfect, it is important to create a plan for what you will do if you experience cravings, make mistakes, or encounter high-risk situations. Medication-assisted treatment, or MAT, has become one of the most effective, evidence-based approaches for treating many substance use disorders, particularly opioid and alcohol use disorders. MAT combines medications with counseling and behavioral therapies. The medication component addresses biological factors such as cravings and withdrawal, while counseling helps individuals develop the skills necessary for long-term recovery. Research consistently shows that individuals receiving MAT often experience better retention and treatment, reduced substance use, and improved overall outcomes. Several medications are commonly used in MAT. Suboxone and Sublocade are used primarily for opioid use disorder. Naltrexone, including the injectable form Vivitrol, can help reduce cravings and block the effects of opioids and alcohol. Acomprosate is often used to support alcohol recovery. One misconception is that MAT simply replaces one drug with another. In reality, when properly prescribed and monitored, these medications stabilize brain functioning and allow individuals to focus on recovery without the constant disruption of cravings and withdrawal symptoms. Alright, so like any treatment approach, MAT has advantages and limitations. The benefits include reduced cravings, prevention of withdrawal symptoms, improved treatment engagement, and decreased risk of overdose and other harmful consequences. However, MAT is not without challenges. Some medications require ongoing monitoring, access to qualified providers may be limited, and insurance coverage can be inconsistent. Additionally, MAT is most effective when combined with counseling and recovery support rather than used as a standalone intervention. The key takeaway is that MAT should be viewed as one valuable recovery tool rather than the entire recovery process. So, for many individuals with substance use disorders, substances become the primary method of managing emotions. Recovery requires learning healthier ways to respond to difficult feelings. An important concept is helping people recognize that emotions are influenced by interpretations and perceptions. Two people can experience the same event and have very different emotional reactions based on their beliefs, experiences, and expectations. When individuals learn to examine their thoughts objectively and challenge distorted interpretations, they often discover that their emotions become more manageable. This creates opportunity to respond thoughtfully rather than react impulsively. Mindfulness has become an increasingly important component of addiction treatment because it teaches individuals how to observe their experiences without immediately reacting to them. When practicing mindfulness, individuals learn to notice cravings, thoughts, emotions, and physical sensations as they arise instead of automatically responding. They develop the ability to pause, observe, and make intentional choices. This is particularly valuable during moments of craving. Individuals often discover that cravings rise and fall like waves. By remaining present and observing the experience without judgment, individuals can learn that cravings are temporary and manageable. The next thing that we are going to talk about is the importance of relapse prevention groups. If you can find a treatment provider that offers specific groups targeted at relapse prevention, it's something I think could be very worthwhile and beneficial. Relapse prevention groups serve several important functions. They provide education, peer support, accountability, and opportunities to develop coping skills. One advantage of group treatment is that an individual can realize they are not alone in their struggles. Hearing others discuss similar experiences often reduces shame and increases motivation. Groups also create opportunities for individuals to receive feedback, challenge distorted thinking, and learn practical recovery strategies from peers who may have successfully navigated similar situations. The other advantage that I will throw out there for, seeking out professional services, relapse prevention groups, is confidentiality. And the fact that they are also going to be facilitated by someone who is trained to be able to lead the group. So it just offers a kind of certain amount of protection. Recovery support groups extend recovery beyond formal treatment. These groups provide ongoing encouragement, accountability, and connection with others who understand the challenges of addiction. Whether a client chooses Alcoholics Anonymous, Narcotics Anonymous, Smart Recovery, or another support network, the common factor is community. Recovery can be difficult when attempted alone, but support groups help reduce isolation and create a sense of belonging. For many individuals, support groups become a long-term source of encouragement even after treatment has ended. I cannot stress the importance of education enough. Education is one of the most important aspects of relapse prevention. Individuals need to understand not only what relapse is, but also how it develops. Relapse is often a gradual process rather than a sudden event. Warning signs typically emerge in cognitive, emotional, behavioral, and physical forms long before substance use occurs. Identifying personal relapse patterns allows individuals to intervene early. When individuals recognize warning signs such as increased stress, isolation, negative thinking, or neglect of self-care, they can take corrective action before a return to use occurs. As we wrap up, remember that recovery is not about being perfect. It's about continuing to move forward, even when challenges arise. Relapse prevention is not simply about avoiding alcohol or drugs. It's about building a life that supports your physical, emotional, mental, and spiritual well-being. By recognizing triggers, developing healthy coping skills, maintaining supportive relationships, and staying committed to personal growth, you can strengthen your recovery and reduce the risk of relapse. If you are struggling today, Know that setbacks do not erase progress. Recovery is a journey, and every day is a new opportunity to make choices that align with the life you want to live. Stay connected, stay honest, and don't be afraid to ask for help when you need it. Thank you for watching, and share it with someone who may benefit from this message. Until next time, keep moving forward and take care of yourself.